Now that we went over athlete needs analysis, athlete testing and program evaluation, and a dynamic warm up and flexibility, now it's time to start talking about resistance training. Resistance training is a mode of exercise that is pretty well known for its role in improving performance, such as increasing an individual's muscular strength, improving their power and speed, increasing muscle size, improving their muscular endurance, improving motor performance, balance, and coordination. So athletes in essentially every sport have benefited greatly from resistance training. But one critical element that kind of dictates the individual's acute exercise response and chronic adaptation is pretty much the design of the resistance training program. So a resistance training program is composite of several different variables that interact with each other to provide some sort of stimulus and then ultimately an adaptation. But what we need to consider is that the differences in the magnitude of the adaptation to training among individuals. So depending on individuals, some may respond more favorably in speed and power compared to other individuals, even though they might be following a similar resistance training protocol. Or some individuals may increase muscle size in certain areas, such as say their lower body a lot higher compared to other individuals. With this, we also need to consider training status. So we know as we become more trained, right, the response to some sort of stimulus is a little decreased compared to, lifting, whenever you're a beginner, or if you've taken a really long break and then start lifting again. Other things to consider about this response is that genetics may also dictate adaptation. And this is where you can really see that, some individuals who, say you and one of your fellow athletes or colleagues go to the gym, you perform, the same sets, the same repetitions for, say bicep curls, but for some reason their biceps become a lot bigger and yours, they don't really change that much. So that's all really due to genetics. So when we think about the resistance training program and these variables, we can pretty much create different ways on programming an athlete's training program, or pretty much designing it. But our major principles of this resistance training program that we're focusing on, or what we're going to be prescribing, is based off of specificity, overload, and progression. With specificity, this refers to aspects such as the muscles involved, the movement pattern, and the nature of the muscle action for the athlete. So just to give you some sort of example of specificity is referring to the vertical jump. And with that being said, a lot of athletes or individuals will perform the squat exercise just because it mimics the same movement pattern compared to the vertical jump, and also utilizes the same muscle groups as the vertical jump. Sometimes used interchangeably with specificity is the acronym SAID, and this stands for the specific adaptation to impose demands. So what this is the kind of underlying principle is that the type of demand placed on the body dictates the type of adaptation that will occur. So if you have an athlete training for power and high speed movements, such as a tennis serve, what you should do is kind of attempt to activate or recruit the same motor units required by their sport at the highest velocity possible. So with this being said, specificity can also relate to the athlete's sport season. So as the athlete kind of progresses through preseason, in-season, postseason, the different forms of training should gradually progress in an organized manner from general lifting, and then get to a little bit more specific. Overload refers to assigning a workout or training regimen of greater intensity than the athlete is accustomed to. And with this overload stress to the athlete, this will lead to some sort of adaptation. Without some sort of stimulus of overload for the athlete, even with a well-designed program that you create, this greatly limits the athlete's ability to make some sort of improvement. So there are different ways to overload for the athlete or individual. If you aren't working with athletes, is increasing the intensity based off of percentage 1RM or percent VO2, whatever the case may be, what you're prescribing. Increasing the number of sessions per week, adding exercises or increasing the number of sets performed, emphasizing complex exercises, or decreasing length of the rest periods. So there are multiple ways to overload an athlete and kind of their stress. But overloading must be applied properly just to avoid overtraining. Just because at some point, if we are overloading too much, say we are having too many sessions per week for the athlete, we can start seeing some sort of overtraining syndrome, and we don't want that, just because with overtraining, this can ultimately negatively affect the athlete's performance. If a training program is to continue producing higher levels of performance, the intensity of the training must become progressively greater. And this is where progression promotes long-term training benefits for the athlete. So there are different ways to progress. One is to increase the number of sessions per week. Another way to progress is increase the number of exercises. So these two are very similar to the overload principle that we just kind of talked about, but just know that this is also very important for the athlete's progression. Another way we can progress for the athlete is moving from a simple exercise to a more complex exercise. So we can have an athlete progress, say, from the front squat to learning the hang power clean, and then eventually learning the power clean itself. When we look at the general population, or typical gym goer, one exercise we can look at moving from simple to complex is the pull-up. All right. But when we think about the pull-up, this is pretty hard for a lot of individuals, lifting their entire body weight up. So how we can progress is, going from an assisted pull-up, utilizing that machine, and then gradually decreasing that weight with the assisted pull-up machine, and then eventually lead them to their own body weight. So just for example, if an individual weighs 200 pounds, right, with the assisted pull-up machine, if we select 100 pounds, we're taking 100 pounds off that individual. So they're really pulling up 100 pounds of their body weight. So as we progress, we kind of decrease the weight utilized for the assisted pull-up. So eventually, that individual can do a pull-up of their own body weight. We can also incorporate other techniques as well, such as isometric holds at different, positions. We can do eccentric movements as well, but that's kind of your progression on what you would utilize in the gym setting. But the issue of importance is that progression is really based on the athlete's training status and individual's training status, and this should be introduced systematically and gradually. A general understanding of the human body's acute physiological responses to training and subsequent adaptations is essential for optimally designing a resistance training program for an athlete or an individual. So when we look at these physiological adaptations, these occur in the connective tissue. This also occurs in the nervous system. There's physiological adaptation that is occurring with the cardiorespiratory system, endocrine system, and probably the most important one that we're talking about, since this is referring to resistance training, is the muscular system. With skeletal muscle, we should know a little bit of background, since we are trying to train and increase muscle growth and increase strength for the individual to improve their performance. But we have different layers on skeletal muscle. So when we look at the first layer, this is called the epimysium, and this surrounds the entire muscle. Next, it's the next layer below that, which is the perimysium, and this surrounds the bundles of muscle fibers, or the fascicles. And lastly, you have the endomysium, which surrounds the individual muscle fibers. When we further look in the skeletal muscle and the individual muscle fibers, they contain thin and thick filaments, which are arranged in cylindrical bundles called myofibrils. And these are approximately 1 to 2 micrometers in diameter and kind of extend from one end of the muscle fiber to another. So with myofibrils, these are the structures that give skeletal muscle and then also cardiac muscle their characteristics of a striated appearance. So this is where if you see any individuals who are very lean, such as the triceps, or also the vastus lateralis and the quadriceps, whenever they flex or anything, that's where you kind of look at that feather look. And this is particularly seen in bodybuilders who decrease body fat to as low as possible, just to look good on stage. But when we think of these myofibrils, these are kind of in a, get different characteristics. We have actin, which is a protein which is characterized as being thin, and then myosin, is characterized as being thick. So if you can see, there's other proteins involved in the myofibrils, but these are the ones that we just want to focus on. If you take exercise physiology or advanced exercise physiology, you'll go a little bit more deeper on some of the other proteins that contain in the myofibrils. Within skeletal muscle, there are different types of fibers. One is type 1 fibers, which are referred to as slow twitch. So we know with type 1 fibers that these are more suited for the performance of endurance activities such as cross country running or marathon running. Within type 1 muscle fibers, these have high levels of aerobic enzyme activity, capillary density, mitochondrial density, and intramuscular triglyceride storage. Also with type 1 muscle fibers, they produce low fatigability. So within that, this is why individuals who have lots of type 1 don't fatigue as much compared to individuals with type 2 during a long distance run. However, though, type 1 fibers don't produce a lot of force, right? So the force production is pretty low when compared to type 2 fibers. With type 2 fibers, these are referred to as fast twitch, and these fibers are suited for the performance of high intensity short duration bouts such as the 100 to 200 meter dash or long jump or high jump, but anything related to explosiveness. Within type 2 muscle fibers, there's a high activity of myofibrillar ATPase, and this is going to kind of rely on producing a faster contraction speed and faster relaxation time, which allows for a greater force production compared to the type 1 muscle fibers. Also with type 2 fibers, these are relying predominantly on the anaerobic energy sources such as your ATP phosphocreatine system and then also your glycolytic system. Within type 2, these have a low aerobic capability and are highly fatigable. So this is where you see individuals who predominantly type 2 fibers, if they try running a marathon or anything long distance, right, they're going to fatigue a lot quicker. But compared to type 1 fibers, these are going to produce a really high force where type 1 fibers aren't. With type 1 and type 2 fibers, there are different subtypes. Type 2A fibers have good aerobic and anaerobic characteristics. So these muscle fibers, or the subtype of type 2 muscle fiber, is going to fall in between type 1 and type 2X. And where type 2X, which was originally called type 2B, fibers have only good characteristics of anaerobic properties. When we look at type 2X muscle fibers, these are unused fibers that upon recruitment start a shift from a transformation to type 2A. So whenever you start resistance training or start training in general, you're going to transition from type 2X muscle fibers to type 2A muscle fibers. Right? And these are going to be, and the reason why you see this is just because you are starting to adapt. There's some other subtypes within type 2 muscle fibers, such as type 2C, which are a little bit more oxidative than type 2A and type 2X fibers. And then we can also have a hybrid within type 2, which is type 2AX fibers, which kind of have a mixed property of aerobic and anaerobic characteristics within that, and kind of making it more of a hybrid. Lastly, type 1C fibers are a little bit less oxidative form of your type 1. As I mentioned, type 2X fibers transform towards type 2A muscle fibers, and this is due to being an adaptation. So this is allowing us to become a little bit more efficient. It is very doubtful that under normal training conditions, muscle fibers transform from type 2 to type 1 or vice versa. And whenever we have a detraining, meaning where we have where we kind of just cease training, this is going to cause a transformation of type 2A fibers back to type 2X fibers. Here's a table looking at the muscle fiber type characteristics for type 1, type 2A, and type 2X muscle fibers. As you can see, you can look at the primary source of ATP, such as either oxidative system or the glycolytic system, and then you can also see some other measurements or other variables that are associated with these different muscle fiber types. The adaptation with skeletal muscle fiber is hypertrophy, which is the increase in muscle size, and this is due to an increase of the individual muscle fibers. Also, because of this, there's an increase in protein synthesis and a decrease in protein degradation, or a combination of both, and this is how we get our muscle growth. Also, within skeletal muscle fibers and some sort of adaptation is that we can possibly see hyperplasia, which is an increase in the number of muscle fibers. When we look at muscle growth between men and women, the absolute amount of muscle hypertrophy with resistance training represents a primary gender difference. So there's going to be some differences when you look at it, the absolute amount. So men experience a greater absolute change in muscle size just because of their larger initial muscle mass. But when we look at a percentage base, this is going to remain pretty similar between genders. But some of the gender-related differences in hormonal response to resistance exercise may determine any ultimate gender differences in muscle size and strength adaptations with prolonged training. Designing a resistance training program is a complex process that requires the recognition and the manipulation of 7 different program design variables. And this is going to include a needs analysis, which we touched on already, but then it's going to transition into exercise selection, the training frequency, the exercise order, the training load and repetitions, the volume, and the different rest periods for different goals. At the beginning of the semester, we talked about an athlete needs analysis. When we kind of further look into this when referring to resistance training, we have some questions to be answered, such as what muscle groups should be trained, what is the basic energy sources that should be trained, is it the ATP PCR system, is it the glycolytic system, is it the oxidative system, what type of muscle actions should be trained. This is also going to refer to the movement pattern depending on which plane. Is it the frontal plane, the transverse plane, the sagittal, or also if you're a golfer, you might be in the diagonal plane. What are the primary sites of injury? What is the athlete's prior injury history? And then what are the specific needs for strength, hypertrophy, endurance, any of these different variables needing to help an athlete increase their performance. The athlete's current condition or level of preparedness to begin a new or revised program is an important consideration when designing any type of training program. And this is going to refer to the athlete's training status. One, we can also look at, when we refer to this training status, like we talked at the beginning semester, what type of training, did they perform recently? What is the length of recent regular participation in their previous training programs? Were they only 4 weeks, or were they kind of longer mesocycles or macrocycles? We can look at the level of intensity involved in their previous training programs. So do we have some sort of progression? So maybe this is a new beginner athlete where we're kind of starting them at a relative intensity, say 100 pounds for their bench press, but following that training program we can increase the intensity. So our second kind of training program or revised training program, that intensity is going to increase just because we're having some sort of overload and then adaptation. And also, what is the degree of their exercise technique? But when it comes to the training status, there's different, kind of training age that people will refer to. So a beginner or untrained, you can see that, the training age is less than 2 months. So that being said, they're pretty new, and usually within 1 to 2 months, this is where you'll really start to see the high levels of adaptations or a big response. When we look at the resist training status for intermediate individuals, these are individuals who have been training about 2 to 6 months, and with that being said, they've been lifting about 2 to 3 times per week. Well-trained resistance individuals are individuals with a training age of 1 year or greater, and who been training for 3 to 4 days. Some individuals, when you're talking about well-trained individuals in itself, will also use another criteria of having some sort of percentage of strength based off the individual's bench press and squat. So it all depends on how you want to categorize these training status, but this provides you a good example or guideline on the different training status for athletes and where they would fall into. Again, when we're doing our needs analysis for the athlete, they have to go through physical testing and evaluation. So when we're looking at our physical evaluation, we're conducting some sort of assessment of the athlete's strength, their flexibility, the power, speed, muscular endurance, body composition, and cardiovascular endurance, and so on. So when we think of this, the test should be related to the athlete's boards. So just to kind of remember that, on which we talked about earlier in the semester. But we can use the results of the movement analysis to select these tests, right? And our movement analysis, again, looking at which planes that the athlete is primarily utilizing, and then the movement pattern. So we can compare these tests or compare these athletes' results with normative or descriptive data to determine the athlete's strengths and weaknesses. But our primary resistance training goal is typically to improve the individual's strength, power, hypertrophy, or muscular endurance. Generally speaking, strength is going to be very important than power, just because most sports kind of rely on that, where hypertrophy is, somewhat of a case of, an increase in muscle growth, can lead to an increase in strength to some degree. But generally speaking, that's not the primary goal, unless you're trying to pack on a lot more muscle for that athlete. So we should kind of concentrate on one training outcome per season, just so we can really focus on that individual's, training goal. Some of it will kind of tie in together. So when we're talking about, strength and power, kind of a byproduct is going to be hypertrophy, and then also possibly a little bit increase in muscular endurance. But remember, specificity is a big thing, where if we're just kind of looking at say strength, sets and repetitions, which we'll talk about later in this lecture, their muscular endurance isn't going to be as well for those individuals who always practice muscular endurance tests. Here is an example of how an individual might prioritize an individual's resistance training emphasis during the course of a season or the calendar year. So you can see with the off season, you have low sport practice, but your resistance training priority is pretty high. But as you kind of transition into preseason, you're starting to be practicing more of your sport, and there's going to be a little bit less, emphasis on resistance training, particularly during the in season. But once we get to postseason, that's going to vary depending on the sport and then the athlete and everything. But you can see this is going to look at the different training goals, where your off season is mainly looking at hypertrophy or muscular endurance, strength and power, and so forth. With the preseason, you're looking at your sport and movement specific types of exercises. But during in season, we just want to have a maintenance and kind of not lose any of those adaptations that you gain during the off season. With the postseason, there's nothing really specific, but you can include activities other than sport, skill, or resistance training. So this could be a little bit more of the recovery based type of exercises, just because during postseason you still want to perform optimally, and with resistance training, that might limit your recovery. Exercise selection involves choosing exercises for a resistance training program. And this is going to require some knowing of the movement and muscular requirements of the sport, the type of contraction, whether it's a concentric, eccentric, or an isometric contraction that is involved, the athlete's exercise technique experience, the equipment available, which is very important. Depending on where you're at, you may not have certain equipment compared to other places, and the amount of training time available. So this can be, very important, because, with athletes and, particularly during the in season, they have to spend more time during practice and less time in the gym. So you're going to have to find what is the most efficient, timely manner for the athlete to gain the most out of their training sessions during the in season. But, during the off season, they can spend as much time as they like on hitting some sort of goal. When we look at the key terms for the muscle mechanics, we can see that forces is broken down into two separate categories, such as tension, which is the force exerted on an object by a contracting muscle, and then the load is the force exerted on the muscle by an object, and this is usually a weight, such as a barbell or dumbbell or kettlebell. There are different types of muscle actions. One is going to be the isometric muscle action, and this is where muscle develops tension but does not shorten or lengthen. We can also look at the isotonic muscle action, and this is where the muscle changes length while the load on the muscle remains constant. And within the isotonic muscle action, they're split up into different categories and terminology, such as the concentric muscle action. This is when tension exceeds the load, so the muscle shortens. And then the eccentric portion is where the load is greater than the tension generated by the cross bridge, which leads to the length of muscle. When looking more into detail of the different muscle actions, we can see that the eccentric muscle action produces greater force per unit of muscle cross-sectional area and involves less muscle fiber activation per level of tension, and by doing so, this is going to ultimately require less energy expenditure. A downside, though, is that an eccentric muscle action produces greater muscle damage. So with the eccentric muscle action, you probably notice this in the gym, that whenever you lower the weight, you can use a lot more weight compared to the concentric muscle action. And this is due to the greater force per unit, and there's also another protein which we didn't talk about, but the regulatory protein that's kind of assisting on producing this greater force in the lengthening muscle action is titin. When it refers to greater muscle damage, a lot of research protocols will utilize eccentric muscle actions just because this is causing greater muscle damage, and by doing so, researchers can see what is how muscle damage is affecting the protein synthetic response, and you can possibly utilize this and see how DOMs are being affected when they initially start, and then kind of the recovery period and the repeated bout effect of that. The concentric muscle action is usually referring to your sticking point. Right? So you probably experienced with when you're trying to perform a 1 RM, you say for the bench press, you bring it down, all right, you start lifting it, and that at some point during that lift, right, you can't fully perform the full repetition. All right, you're kind of stuck and you're kind of struggling and pushing as hard as you can. It's not going anywhere. So this is determining or kind of signaling that this is the weak point of the exercise in that particular range of motion for you. So this is where you can utilize different strategies on helping this sticking point. So for bench press, you can kind of place a wooden block at your chest or wherever the bar is usually hitting, and kind of improve your sticking point or your concentric muscle action of that area. An isometric muscle action exists in different forms in resistance training. There's stabilizer muscles that provide reactive forces to maintain posture during exercise. This is going to be kind of helping you kind of not have those rounded shoulders, and kind of have that hunchback. You can also utilize these isometric muscle action exercises in between eccentric and concentric actions for the agonist muscles. So kind of generally speaking, your isometric muscle action is going to always somewhat occur when you're going through a range of motion. You'll have isometric muscle actions when gripping weights, the primary action of the exercise in a specific area of the range of motion. You may do, isometric holds, say for, the squat. So that's going to be your wall squats, and that's going to kind of be, at the 90-degree angle for that. And also probably the most popular isometric muscle action for resistance training is going to be planking, and this is going to kind of affect your core and your stabilizers around there. There are hundreds of resistance training exercises to select from when designing a resistance training program, but exercises can be classified as either core or assistive based on the size of the muscle areas involved and their level of contribution to a particular sport movement. So when we look at core exercises, these are recruiting one or more large muscle areas, such as the chest, the shoulder, the back, the hips, or the legs, but this is going to involve 2 or more primary joints. So these are often called multi-joint exercises and kind of receive the priority when you're selecting exercises because of their direct application to the sport. The other thing, or the other type, is going to be assistive exercises, which usually are going to recruit smaller muscle areas such as the upper arm, abdominals, calves, and so forth. And during this is only going to involve one primary joint or single joint exercise. And these are considered less important to improving sport performance, but kind of generally all the joints at, say, the shoulder, such as the glenohumeral and shoulder girdle articulations, are kind of considered a primary joint. When resistance training exercises are categorized as core or assistive. When we look at the spine is kind of considered a single primary joint as well. But a common application, though, for these assistive exercise is for injury prevention and rehabilitation, since these exercises, isolate a specific muscle group or a specific muscle. So the muscles that are, predisposed to injury from the unique demands of the sport, or those that are requiring reconditioning after an injury, can be specifically conditioned by these assistive exercises. When we look at the joint involvement within the exercise, whether it's a single joint or a multi-joint exercise, both are effective for increasing muscular strength. Even though single joint exercises are primarily applied for injury prevention and rehabilitation, there is possibility that it can transition into increase in performance. But the single joint exercises are less complex. So this is comparing, say, the knee curl to the squat, where the knee curl, you don't have that much, practice, or you don't need that much skill to perform a knee curl. But whenever you're talking about the squat, you're going to have a lot more skill involved, such as keeping your balance, the coordination of it, and so forth. With multi-joint exercises, this can be kind of split up into two different portions, where we can have multi-joint exercises being, basic strength, where these exercises involve at least 2 or 3 major muscle groups. But we can also have multi-joint exercises which are, focusing on total body lifts. And this is involving most major muscle groups. And we can think of these, or an example of total body lifts are going to be Olympic lifts. When incorporating single and multi-joint exercises, these can be performed with different types of equipment, such as free weights or machines. When we look at free weights, these are often referred to as barbells, dumbbells, and then any associated equipment involved, such as plates or kettlebells. When we look at machines, these are specifically designed equipment that provide resistance with some prescribed range of motion and movement pattern. Both are, considered to be included into a resistance training program, where both free weights and machines are very effective in increasing muscular strength and performance, but they do have advantages and some disadvantages within them. So when we think of free weights, these require the lifter to control all aspects of the exercise. So, the stabilizer muscles are stressed to a higher degree when free weights are, performed compared to the machine. So, when we think of, machines, they provide greater stability and control the path of movement, and also they are regarded as safer and easier to learn initially. So this is where you're taking individuals who are beginners or novice, having them perform exercise in machines, and then slowly progress into free weights. You can also utilize machines with the elderly, just because as they get older, they don't have as much skill as they used to. All right, and requires a lot more of that. And also you can utilize machines for rehabilitation. But a big thing with the type of equipment that you're utilizing is not only whether it's free weights or machines, but the availability of it should be considered as well. So if you're lacking certain equipment, this may necessitate selecting certain exercises that are not as sport specific. So you have to consider that. So it might take some improvisation or improvising whenever you are selecting these exercises, and this is based off of what is available within the resistance training room. A way to vary exercise performance is to alternate between unilateral, which is performing an exercise with one limb, and bilateral, which is an exercise performed with both limbs for the same prime movers. The level of muscle activation differs when an exercise is performed either unilaterally or bilaterally. So with unilateral training, we may increase bilateral strength in addition to unilateral strength, and then bilateral training may increase unilateral strength as well. And also with bilateral training, we can reduce the bilateral deficit. So this is kind of a term that, the maximal force produced by both limbs together is smaller than the sum of the limbs contracting unilaterally. So the bilateral deficit may be, minimal in well-trained athletes. So, unilateral and bilateral exercises are both recommended. When we look at, the performance perspective, a closed chain kinetic exercise has a higher degree of transfer of training effects to specific sporting movements and activities of daily living. So remember, a closed chain kinetic exercise is one where the distal segments are fixed, such as performing a squat or deadlift, where an open chain kinetic exercise is enabling the distal segment to freely move against a resistance. And this is, an example would be knee curls or bicep curls. But, both, there are, kind of high correlations between closed chain kinetic exercises and performance in the vertical and standing long jumps. In addition, other research has found that training with a closed kinetic chain exercise such as the squat produced a higher increase in vertical jump performance compared to an open chain exercise where it didn't really produce any exercise or any exercise performance benefit. So whenever we are creating our training program, a closed chain kinetic exercise should be the form or the kind of core foundation for these programs. When we're also selecting our exercises for the resistance training program, remember, the more similar the training activity is to the actual sport movement, the greater the likelihood that there will be a positive transfer to that sport. So this is the specificity concept that I mentioned, but remember, this is also called the specific adaptation to imposed demands principle. Right? And here we can see some sort of the table provide examples of resistance training exercises that relate in varying degrees to the movement patterns in various sports. So as a strength and conditioning professional, you should find this table helpful when trying to identify sport-specific exercises. So let's just say, for example, the primary muscles involved in jumping for basketball are the hip and the knee extensors. So an athlete can exercise these muscles by performing the leg press or the back squat. But as a strength and conditioning professional, which exercise is preferable, since they both strengthen the hip and knee extensors. But since the body is, or the kind of jumping is performed in an erect state, kind of standing position with the balance and weight bearing forces, the back squat is going to be more relevant to jumping compared to the leg press. When we look at the movement analysis of the sport for an athlete during our needs analysis portion, selecting exercises for the specific demands of the sport should maintain a balance of muscular strength across the joints and also between the opposing muscle groups. So as strength and conditioning professionals, we want to kind of avoid designing a resistance training program that increases the risk of injury due to a disparity between the strength of the agonist muscle, which is the muscle or muscle group actively causing the movement, such as the quadriceps in the knee extension exercise, and the antagonist, which is the passive portion or muscle group that's located on the opposite side of the limb, such as in this example the hamstrings during the knee extension. So if there's some sort of imbalance that is created or discovered, we need to have exercises to kind of restore an appropriate strength balance for that athlete. So we can test, these disparities between the agonist and antagonist by, say, using a biodex, looking at the isokinetic individual strength, and it can reveal some differences where we can say that the hamstrings are really weak compared to the quadriceps. So we can then make our exercise selection of incorporating a lot more hamstring dominant exercises compared to quad dominant exercises. But just to know or kind of realize that muscle balance does not always mean equal strength, but just a proper ratio of strength of muscles that are being utilized, the power possibly, or muscular endurance for those selective muscle groups or relative to other muscle group areas. An important part of the needs analysis, on which we already talked about, is the athlete's training status, and also along with that comes their technique experience. So if you have any questions relating the athlete's technique skills or their experience, we can always ask the athlete to demonstrate a particular exercise, such as the power clean. But after you have them perform that type of exercise to see if they are doing it correctly, we can provide some feedback on proper instruction of completing it correctly. Oftentimes, when we're looking at unskilled individuals or beginners, we often start with them with the very basics of proper form and technique. So when we're thinking about deadlifts, you can always start the individual just using a broomstick and just practicing their technique, and then slowly progressing them to utilizing the plates. But just don't always assume that the athlete will perform an exercise correctly. I'm sure whenever you are lifting, your technique isn't always correct, or if you're in sports, the strength and conditioning individual is always correcting you, so you can eventually have the safest way to perform that exercise. It's always good to have some sort of critique available to you as well. Lastly, another thing that we can talk about during this exercise selection is the available training time per session. So I mentioned this earlier, but we have to prioritize, our exercises on what we are, selecting for the athlete, particularly during the in season, just because, the time that athlete is going to spend in the training room is going to be less compared to the off season. So they're going to be spending a lot more time on the practice field. So whenever they do come in, we have to make sure that they are very time efficient with the exercises in hitting their goals. Training frequency refers to the number of training sessions completed in a given time period. So for a resistance training program, a common time period is 1 week. Here are just some general guidelines based off of training status, where you have initial or beginners perform exercise 2 or 3 times per week. Whenever you become more trained at an intermediate stage, this is performing exercise or resistance training 3 or 4 times per week. And then more specifically, you can kind of develop a split routine. And then for advanced individuals, this is performing resistance training 4 to 6 days per week. And then also you can have individuals perform 2 sessions per day. The training status is a factor in determining the training frequency for that athlete. Traditionally, 3 workouts per week are recommended for most athletes because the intervening days allow sufficient recovery between sessions. So as an athlete kind of adapts to the training and becomes better conditioned, and this is due to the overload and then progression, it is appropriate to consider increasing the number of training days for more adaptation. And this can be increased to 4 sessions per week, 5, 6, and in some cases even 7 days. But a general rule of thumb is to kind of schedule the training sessions to include at least 1 rest or recovery day, but no more than 3 between sessions of the same muscle groups. If so, we can possibly see a loss in adaptation. So just say, for an example, you have a beginning athlete to perform a total body resistance training program, 2 times per week. We just want to have it evenly spaced, so Monday, Thursday, or Tuesday, Friday. But if the athlete is training only on Monday, Wednesday, we have that long gap from Wednesday to the next training session on Monday, and that stimulus that we apply to them, which may result in a decrease in their performance or their adaptation. But with more highly resistance trained individuals, we can augment their training by using a split routine, whether that's an upper or lower body day, or just looking at specific muscle areas. And this is often common in bodybuilding, where Monday is just all chest, Tuesday is considered like back day, Wednesday's leg, Thursday shoulders, and then day 5 or Friday is going to be like your arms for that. So that's kind of your different split routine. You can also kind of have a double split routine where you have 2 sessions per day emphasizing different muscle groups. So this double split routine is having, say, you performing and having an athlete perform, lower body exercise in the morning, and then later in the day, you can have them perform, an upper body type of exercise or some sort of program. So you have these different programs, and this is, again, remember, all based off the individual's training status, their training history. Are they used to this intensity? Because if you have a beginner and try to put them on this double split routine, they might eventually just go into overtraining, and then they might not have any adaptations, or the adaptations that they did gain, all right, they're going to start to decrease. Here are some examples of common split routines. You can see with the top portion, this is split up into upper and lower body days, where the lower body is performed at least twice a week, and same with the upper body. So you can see with lower body, this is performed on Monday and Thursday, and the upper body is performed on Tuesday and Friday. Right? And we have our appropriate rest days in between. But as you get, again, as you become a little bit more trained in everything, you can start splitting your routines differently. So you can see with the second example with, training day is consisting of chest, shoulders, and triceps. Another day is lower body, and then back, trapezius, and then the biceps. And during this split, this is kind of split up into 5 days per week, where you have a little bit more emphasis for your chest and shoulders and your triceps, but then also you are incorporating lower body exercise, and with back exercise, it's only 1 day per week for this example of a split routine. The last one is kind of following a similar kind of protocol, but in this case, this is going to be consisting of a chest and back day, a lower body day, and then shoulders and arms. And you can kind of see the routine here with at least 1 day of rest during Wednesday. So in this case, this is for an advanced lifter where they're lifting at least 6 times per week. And there's a whole bunch of different ways that you can kind of structure this, but these are just some examples for you. So we kind of talked about this on general training, on kind of looking at our training goals for the athlete, on how we have different emphasis placed on, off season to preseason, in season, and then postseason. But when it comes to training frequency, that kind of also follows a similar manner, where we have seasonal demands of the sport, which may limit the time available for resistance training. So again, this kind of ties in with that, where during the off season, you're going to have a lot more frequency as far as resistance training time goes, and meeting those specific goals. But as you kind of get into the actual in season, this is where we kind of want to maintain our goals of what we accomplish during the off season, and that resistance training program or frequency can be limited to once per week, or maybe possibly 3 as well. For that. So, this is also where this is becoming where our time efficiency comes into play as, programming for our athletes. So just for example, not only figuring out, what are the best exercises for the athlete to get the most during that time window, but, exercise selection as well. So rather than having them perform a squat, you may just have them perform a leg press, which takes less time compared to a back squat in the preparation time. So we have athletes who train with maximal or near maximal loads, but they require a lot more recovery time before their next training session. So the ability to train more frequently may be enhanced by alternating lighter days and then heavier training days. So depending on when the competition is, you might have them, have a heavier day, such as lifting, 80 to 90% of their 1RM, and then, later on in the week towards possibly, towards their competition, you might have a lighter day where they're only working about 50 to 65% of their 1RM. So that's all going to be based off the athlete, again, their training experience, where their competition is at, and then, how well they can actually recover in general. But there's some evidence that, the upper body muscles can recover a little bit more quickly from heavy lifting days compared to the lower body. In possibly one reason why we see this is because, we feel the, effect of lower body exercise pretty much all the time, just because we're walking, we're utilizing our legs to getting up and down out of the chair, going up and down the stairs. So that's where we possibly see why the upper body recovers a little bit more quickly compared to the lower body. But with the, athlete, we also want to compare the multi-joint exercises compared to single joint exercises. And we kind of see that the single joint recovery is quicker compared to the multi-joint exercises. Exercise order refers to a sequence of resistance exercise performed during one training session. So there are different ways to arrange exercises, but decisions are invariably based on how one exercise affects the quality of effort or the technique of another. So usually when we kind of arrange these exercises, these are arranged so that the athlete's maximal force capabilities are available to complete a set with proper exercise technique. So this is where we want to perform, say, a power clean before we go into, say, a leg press for the day. Or we utilize, a bench press or, deadlift before we start doing any other exercises such as leg curls or tricep pushdowns. But, we have to look at these different methods of order for resistance exercises, and by doing so, we can properly set up a program. When we look at power exercises such as the snatch, the hang clean, power clean, and push jerk, these should be performed first in the training session, followed by other non-power core exercises such as the squat, and then followed by assistive exercises, say the knee extension exercises. But, when we are kind of ranging this, exercise, we have these multi-joint exercises and then single joint exercises, where pretty much the, hang clean and push jerk and all that is working your major muscle groups, and then your assistive ones are working your smaller ones. So the reason why we want to kind of, perform power exercises is because they require the highest level of skill and concentration of all the exercise and are probably the most affected by fatigue. So if your athlete is, who is becoming fatigued or is fatigued, they are a little bit more prone to using poor technique, and then by doing so, they're at a higher risk of injury. So the explosive, movements and the extensive muscular involvement of these exercises also require significant energy expenditure. So this is why we're going to have, talk about this a little bit later, but proper rest periods. So by having them do this first while they're, pretty fresh, then they won't be prone to injuring themselves. But if you aren't having power exercises, then it's kind of recommended that you utilize core exercises first, such as, say, like the squat, and then you move on to assistive exercises. A method of providing the opportunity for athletes to recover more fully between exercise is to kind of alternate upper body exercises with lower body exercises. So this is especially helpful for untrained individuals who find that, completing several upper body or even lower body exercises in succession is too strenuous. So this is where, fatigue comes in. And this is also where these individuals aren't hitting their repetition goals for that particular set. But if training time is kind of limited, this method of arrangement of, upper followed by lower body exercises minimizes the length of the rest periods required between the exercises and maximizes the rest between the body areas. So due to this, there's a decrease in overall training time just because the athlete can perform an upper body exercise and then immediately go into a lower body exercise without having to wait any recovery time for the upper body exercise to recover. So, if the exercises are performed with minimal rest, such as 20 to 30 seconds, this method is referred to as circuit training, which is sometimes used to improve cardiorespiratory endurance. Although this is a little bit lesser in extent to just conventional aerobic exercise, such as running at a pace of 9-minute mile or whatever the case may be, or a percentage of your VO2 max for so many miles. Another method to improve recovery between exercises is to alternate pushing exercises with pulling exercises. So this push-pull arrangement ensures that the same muscle group will not be used in 2 exercises and sometimes sets in succession, thus reducing the fatigue involved in the muscle. So if we are, kind of looking at this, if we are having an individual do a lot of pulling exercises one after another, such as, a pull-up, bent over row, seated row, and hammer curl, one after the other. Even with appropriate resting periods, the bicep brachii muscle will become less responsive, and you may have your individual or athlete not hit the goal. And this is due to fatigue. And this would, occur similarly to the upper body if you're looking kind of at the triceps. If you had them perform, incline bench press, and then shoulder press as well. You can also do some lower body push-pull exercises. So when we look at the leg press and back squat, you can consider that as the push exercises. And then a stiff-legged deadlift or a leg curl would be considered a pull exercise. So overall, this push-pull type of alternation of exercise is kind of similar to your upper and lower body exercise alternation, but again, this is not segmenting the body of upper and lower. Another way to arrange exercise order for the athlete is having athletes perform one set of a pair of exercises with little to no rest between them. And by doing so, there are some examples, and these examples are supersets and compound sets. So I'm sure you've heard these terminologies before, but a superset involves 2 sequentially performed exercises that stress 2 opposing muscles or muscle areas, so an agonist and antagonist. So a superset, for example, would be having your athlete perform 10 repetitions of knee extension exercise, and then follow that by 10 repetitions of leg curl exercise. A compound set involves sequentially performing 2 different exercises for the same muscle group. So for instance, we can utilize an athlete completing a barbell bicep curl and then switching it to dumbbells and performing some sort of hammer curl. Right? So oftentimes though, both methods of performing this type of exercise can be used interchangeably. So you'll sometimes hear people use superset, where we are performing 2 different exercises for the same muscle group, and then vice versa. So it can be a little bit confusing, but the actual definitions are the superset, which is stated here on the slide, and compound set. This is another method of kind of arranging your exercise and kind of being a little bit more time efficient, and possibly you might be hitting your certain metabolic goals or demands for that training session for the athlete. So this is a little bit more high intent, so this is going to relate to individuals following that category. Another method is a pre-exhaustion, and this is where you're having one individual perform a single joint exercise that is performed first, and this is followed by a multi-joint exercise. So for example, we can have an individual perform knee extension, and then the next exercise would be the squat, so they can get a little bit more out of that. You often see this pre-exhaustion technique involved with bodybuilders, particularly if they're like lagging in some sort of body part. So say for example, the chest muscle, a lot of people will do dumbbell flies, and then they'll do a bench press to kind of pre-exhaust the chest, just because whenever you're doing bench press, usually that's the last muscle activated while you're getting fatigued. You usually feel the fatigue and everything in the triceps and the front delts, and then last in the chest. But if you're pre-exhausting that, the theory of it is that those chest muscles are going to be recruited a lot sooner, and by doing so, you're going to have some sort of positive adaptation. Another program variable to look at is the training load and repetition. During this time, we often refer to this as looking at the load aspect. So when we are talking about the load, this is referring to the amount of weight assigned to an exercise set, and is often characterized or may be considered the most critical aspect of a resistance training program. But when we are trying to quantify work, we want to look at the kind of mechanical work for our athlete or individual. Mechanical work is the force times displacement. But it's important to quantify the amount of mechanical work or some sort of degree of metabolic demand to kind of plan variation in the training program and to avoid the exhaustion phase of Slay's general adaptation syndrome, which is associated with overtraining. So we'll talk about a little bit more of these adaptations when you start training, such as the exhaustion phase, whenever you start getting into periodization. But we can make this measurement by quantifying it by multiplying the amount of weight that the athlete lifted by the number of times it is lifted, and then summing that value. And this is where you get the terminology volume load. So again, to find the quantity of work for an athlete on which they perform, we're calculating the weight that they utilize times the total repetitions. One thing to know is that the volume load is not affected by the rep and set scheme. So 15 sets of 1 repetition, 5 sets of 3 repetitions, or 3 sets of 5, or 1 set of 15 repetitions. All right, the volume load isn't going to be affected by that type of scheme. But the various repetition and set schemes affect the true intensity value for resistance exercise and indicates the quality of work being performed. So just kind of generally speaking, it's good to have some sort of approximation for mechanical outlook and kind of looking at the quality of work that the athlete performed in that training session. And then also you can kind of utilize that to help build your other different blocks of training for that athlete to hit their goals. When we think of repetitions, this is referring to the number of times an exercise can be performed. And with this, the heavier the load, the lower the number of repetitions that can be performed. So when we are kind of assigning training loads for our athletes, we are commonly characterizing this as some sort of percentage based off a 1 repetition maximum or 1 RM, or as a repetition maximum RM. So we have to know and define the differences between these two different terminologies, where the 1 repetition maximum is the greatest amount of weight that can be lifted with proper technique for only 1 repetition. And when we look at repetition maximum, this is the most weight lifted for a specified number of repetitions. So here's a table that shows the relationship between a submaximal load, which is calculated as a percentage of the 1 RM, and the number of repetitions that can be performed at that load. So when we look at this table, 100% of the 1 RM allows the athlete to perform 1 repetition. So as you see the percentage of the 1 RM as it decreases, the athlete will be able to successfully complete more repetitions. So even though this is a table that provides some helpful guidelines for assigning an athlete's training load, these are not always precise for establishing the actual training loads for your athletes or individuals, and this is based on some assumptions. One is that this assumption of at 87% 1 RM they can only do 5. This is assuming that there's a linear association between the load lifted and the repetitions performed. But we kind of realize that there's this curvilinear relationship. Another assumption is that resistance trained individuals may be able to exceed the number of repetitions listed based off of this table here, right? And this is particularly in the lower body, where if you had individuals perform 85% for 6 repetitions, they might exceed that repetitions and go to 8 or 10. Another assumption is that the number of repetitions that can be performed at a certain percentage of the 1 RM is based on a single set. But we know as resistance training programming, we want our athlete to perform multiple sets. And despite some of this prevalence of 1 RM, athletes may not always perform the predicted number of repetitions based off this particular 1 RM set. Right, and sometimes they are able to perform more repetitions than actuality. The Another assumption is that a certain percentage of the 1RM assigned to, say, a machine exercise can result in more repetitions. So you have to take that involved, just because you're kind of changing the biomechanics, all right, and not requiring as much energy whenever you're doing a free weight exercise and that involved. Exercise involving smaller muscle areas may not produce as many repetitions, where exercise having large muscle areas are likely to result in more repetitions performed. So, the most accurate relationship between percentages of the 1RM and then the maximum repetitions possible is for loads greater than 75% or less than 10 repetitions. So, once you get past 10 repetitions, then that kind of starts getting into a little bit hazy. But we still want to calculate loads for these athletes based off the percent 1RM. Really, the best ideal thing to do is have these individuals perform an actual 1RM for a specific movement, and then utilizing that percentage. But if we're trying to calculate the weight for them, we can kind of estimate that based off of, say, a repetition maximum of them performing 10 repetitions at 60 kilograms for a back squat. A way to gather information needing to assign these training loads utilizing a percentage of 1RM is actually having the individual perform a 1RM test. So this is going to require adequate training status, such as you falling in the immediate or advanced category, and the experience with the exercises being tested. Generally speaking, you don't want to have a novice individual perform a 1RM just because, one, they don't know the proper technique, two, it might be too strenuous for them. Another thing is that it can also injure them just because they don't know the proper form as well. So this is where experience comes into play. So it's okay to have them perform this 1RM a little bit later after you incorporate into their training and after you've shown them the proper technique and everything. So when they do come to this 1RM training or testing to see how they progress, they'll be able to do it correctly. But we want to choose core exercise for this 1RM testing, such as the squat, bench, shoulder press, but we want to use core exercise. We really don't want to utilize a bicep curl for 1RM testing. But we want to choose exercises that can accurately and consistently assess muscular strength and that allow the athlete to maintain correct body position throughout the testing. So this is where we want the individual or athlete to have proper, technique. But most of these core exercises we want, as I just mentioned, I talked about the squat, the bench, you can utilize shoulder press, but also some core exercises to consider performing a 1RM is the deadlift, the power clean, and hang clean. When a maximal strength test isn't warranted, testing with a 10 RM or 10 repetition maximum load is a suitable secondary option. So this approach is appropriate for nearly all athletes, provided they can demonstrate the proper technique in the exercise being tested. So there are different ways to kind of estimate a 1RM. Not only can we utilize the 10 RM load, we can utilize this by using a table. So to kind of estimate the athlete's 1RM using this table, all we have to do is looking at the certain columns of the amount of repetitions or maximum amount of repetition maximums that they did with the weight that they utilize, and then looking over and how it converts into a 1RM. So for example, if we have an athlete's 10 repetition maximum is 300 pounds, looking at the table, the estimated 1RM is 400 pounds. We can also utilize, prediction equations as well to kind of predict your 1RM from these repetition maximum loads. But, again, kind of what we just talked about, these, formulas that you are utilizing are a lot more accurate when the number of repetitions performed are 10 or less. So again, the further you get out, from the, 1RM itself, so performing 15 repetitions, 20 repetitions, right, that's going to kind of decrease the accuracy of the, estimating your, true 1RM, or say you perform, an 8 repetition maximum, you're going to be more likely hitting that goal of that estimated 1RM. Another option for determining training load requires the strength and conditioning professional to first decide on the number of repetitions, or this is often referred to as goal repetitions. So this is where the athlete will perform in the actual program for the exercise that's being tested. So let's say, for example, if we have the strength and conditioning professional decide that the athlete should perform 6 repetitions for a bench press exercise in the training program, the multiple RM testing protocol should have the athlete perform the exercise with a load that will result in 6 repetitions. Other things to kind of look at is that multiple repetition maximum testing for assistive exercises should be at or above an 8 RM to minimize the isolative stress on the single joint involved in the connective tissue. So kind of in general, even if an athlete is following a muscular strength training program that involves 2 RM loads for the core exercises, the heaviest load the assistive exercise should be assigned to is a 8 repetition maximum. Once you determine an athlete's maximal strength, you can start then deciding on the training goal, which can then be applied to determine the specific load and repetitions utilized for that goal. But we're looking at this and trying to set these certain repetitions to hit these goals, and this is utilizing a repetition maximum continuum, where we use relatively heavy loads if the goal is strength or power. For utilizing moderate loads, this is going to fall in the training goal of hypertrophy or increasing muscle size. If we are utilizing light loads, this is more geared towards the training goal of muscular endurance. So a certain repetition maximum emphasizes a certain outcome, but training benefits are kind of blended at any given repetition maximum, so you'll start to see a little bit of an overlap. This figure shows how the repetition maximum ranges are associated with the training goals. So as you can see highlighted in yellow, these are the specific or kind of repetitions that are utilized for that training goal. So for strength, we can see that repetitions of less than 2 or between 2 and 6 is going to focus on that. With power, 2 to 5. Hypertrophy, you kind of start seeing it, kind of have an overlap with strength of 6 repetitions. Going to 12, and then with muscular endurance, you can see highlighted yellow. This is where you're going to start seeing some benefits starting around 13 repetitions and beyond. So despite the physiological blend of the training effects, the specificity principle still dictates the dominant outcome that is attained and enhanced with a particular training load. So the relationship between the percentage of the 1RM and the estimated number of repetitions that can be performed at that load allows you guys to assign a specific resistance to be used for an exercise in a training session. So the training goal is attained when the athlete lifts a load of a certain percentage of the 1RM for a specific number of repetitions. The particular load and repetition assignments are indicated on the athlete's training of a single effort power event, such as the shot put, high jump, or weightlifting, or for a multiple effort power event, such as individuals playing basketball or volleyball. So when we look at single effort event athletes, they may be assigned to sets of 1 to 2 repetitions while utilizing a intensity of 80 to 90% of their 1RM. Particularly on their heavy days training, if you're alternating between lighter and heavy training days to allow for some sort of recovery. But individuals who have multiple maximum power efforts, sport individuals such as volleyball players, you may be prescribing 3 to 5 repetitions per set with a load between 75 to 85% of their 1RM, which is maybe most appropriate. When we kind of look at maximal power, this is produced by lifting light to moderate loads and not just heavy loads. 1RM strength, is maximal strength, and this produces a slower velocity and maximum force and a reduced power output. So when we kind of look at the percentage based by utilizing the 1RM, and how it pertains to the power exercise is that the percent 1RM load is lower for power exercises compared to the traditional 1RM or percentage 1RM repetition relationship, just because the quality of the movement technique will decline before momentary muscle fatigue. So this allows the athlete to complete the repetitions with maximum speed to promote maximum power development. When training for muscular strength and power, this places a high physiological stress on the athlete's body. So intermediate and advanced resistance trained individuals are accustomed to lifting these heavy loads and possess the experience and motivation to exert to near failure on every set. But this should not always be the goal. Despite the high training status of these individuals, this degree of training demand typically cannot be tolerated for very long without some sort of consequence. And this consequence is leading to overtraining. So if we have an athlete who resistance trains 3 times a week and their training goal is muscular strength, it would be difficult for that athlete to perform a very high level of strength of using a high load, low volume regimen, particularly in the power and other core exercises with only 1 or 2 days rest in between. So a strategy that we want to use to kind of balance and possibly try to prevent the overtraining with this heavy load continuous throughout the training program is incorporating lighter days. So we want to use these lighter days to kind of promote some sort of recovery while still maintaining that training frequency and volume. So if we go back to our 3-day example, we can have Monday as our heavy day, our Wednesday as a light day, and Friday as a medium day. And this light and medium will vary depending on the individual, but you can kind of get the gist of that. Maybe a light day would be 50 to 65% of the individual's percent 1RM, and a medium day would be say like around 75, where we have our heavy days are 85% or above. Other things to consider when we're looking at the load and repetition is the progression of the training load, and this is referring to the timing load increase. So as the athlete adapts to the training stimulus, the load must be increased so that the improvements will continue over time. If not, they're not going to see any adaptations. So monitoring each athlete's training in response helps the strength and conditioning professional know when and to what extent the load should be increased. So with this timing load increase, a conservative method that can be used to increase the athlete's training load is the 2-for-2 rule. So if the athlete can perform 2 or more repetitions over the assigned repetition goal for a given exercise in the last 2 sets in 2 consecutive workouts, the weight should be added to that exercise for the next training session. So for example, if we have or are assigning an athlete 3 sets of 10 repetitions for the squat, and the athlete performs all 10 repetitions in all the sets after several workout sessions, depending on the athlete and everything, the athlete is then able to complete 12 repetitions in the last set for 2 consecutive workouts. Then you would increase that intensity or load for them. So when we think of the quantity of this increasing in load due to their progression and the 2-for-2 rule, this is based on some general guidelines, but here table 17.1 kind of gives you some examples or general recommendations based on the athlete's condition, and then kind of also the body area is split up between upper and lower body. So, despite these guidelines, there's significant variation in training status, volume loads, and exercises, which is going to greatly influence the appropriate load increase. So, generally speaking, we want to have relative increases of, between 2.5 to 10%, which can be used instead of these absolute values here seen in this table. So just looking at this table, we can see that for the upper body, individuals who are a little bit less trained or quote unquote weaker, their increase is going to be between 2.5 to 5 pounds for the upper body, and the lower body is going to be between 5 to 10 pounds. If you're looking at more trained individuals, that increase for the upper body for increasing their load is going to be between 5 to 10 pounds, and their lower body is 10 to 15 pounds. So again, this was all depend on the exercise involved. When we look at a different program variable to consider when creating our resistance training program for our athlete, here are some key terms. When we look at volume, this is the total amount of weight lifted in a training session. When we are considering a set, this is a group of repetitions sequentially performed before the athlete stops to rest. The repetition volume, this is the total number of repetitions performed during a workout session. And then volume load is the total number of sets multiplied by the number of repetitions per set, which is then multiplied by the weight lifted per rep. When we look at volume, we have to consider the amount of sets we are prescribing for the athlete. So some individuals have advocated that one set of 8 to 12 repetitions, which is performed to volitional muscular failure. So between 8 to 12, that's your range, and you can't do anything more between that, is sufficient to maximize gains in muscular strength and hypertrophy. So single set training may be appropriate for untrained individuals or during the first several months of training, but usually we can also utilize this strategy for your average gym goer. But generally speaking, individuals who are intermediate or advanced resistance trained, higher volume may be necessary to promote further gains. Just because say performing 3 sets of 8 continuously, you're not going to see any adaptation, and the individual is just going to get used to the stimulus, and they're just going to be stagnant in their gains. One thing to realize though, whenever you are prescribing multiple sets, is that the athlete might not be able to successfully complete multiple sets with the goal repetitions or repetition maximum loads for every exercise. So you may have say you have the 3 sets of 8 for the training goal for the athlete, but first set they hit 8, second set depending on resting period and everything, they may only get 7, and then the third set they may only get 5. So you need to realize that, and that's where you still prescribe that certain load for the athlete. So eventually all 3 sets they hit 8, and then following the 2x2 rule, after they get more than 2 repetitions in the last set for 2 consecutive workouts, and then you can start increasing that volume. The training volume is going to be directly based on the athlete's resistance training goal. So when we look at strength and power, we can see here on this table that strength, the goal repetition is going to be 6 or less, and with sets, this is going to be between 2 and 6 sets. When we look at power, depending on if you're mainly a single effort event or an athlete involving multiple effort event, we can see the different goal repetitions, where the single effort event is going to be between 1 to 2 repetitions with 3 to 5 sets being performed, and with multiple effort event, this is going to fall in the goal repetition of 3 to 5, and similar to single effort within 3 to 5 sets. But the volume assignments for power training are usually a little bit lower than those for strength training, and this is in order to maximize the quality of exercise. And remember, it's important for the technique. When we look at muscle hypertrophy, it is generally accepted that a higher training volume is associated with this increase in muscle size. So this is the result of both a moderate to higher number of repetitions per set, and we can see this in the table with the goal repetitions for hypertrophy is 6 to 12. And for the sets is between 3 to 6 sets. It's been suggested that performing 3 or more exercises per muscle group is also going to help with that increase in muscle size. For muscular endurance, this is for individuals performing 12 repetitions or greater, and you can see with the sets, it's between 2 to 3. So this is a little bit different to the hypertrophy training or goal, where this time the sets are going to be a lot lighter as far as the load, and these individuals are performing a little bit fewer sets, as you can see. So with hypertrophy, you can see that the minimum would be 3 sets. With muscular endurance, it's going to be 2 sets. The last program variable that we'll look at is the rest periods, and this is the time dedicated to recovery between sets and exercises, and is called the rest period or interset rest. So the length of the rest period between sets and exercises is highly dependent on the training goal, the relative load lifted, the targeted energy system, and the athlete's training status. So with this, the heavier the load lifted, the longer the rest period the athlete will need between sets in order to safely and successfully complete the prescribed subsequent sets. If we have athletes who seek to perform maximal or near maximal repetitions with a heavy load, they'll usually need a longer rest period, especially for lower body or all body exercises. So when we think of strength and power, this is going to be highly dependent on the ATP PCR system. Our general guidelines for resting or for our rest period is going to be between 2 to 5 minutes. But it generally takes at least 3 minutes for the majority of repletion to take place. With that being said, the high intensity lifting performance requires the availability of the maximal energy substrate in order to perform the set with minimal or no fatigue. So this is why we have this rest period or longer rest period. When we look at muscle strength though, and we can still see increases if we kind of utilize a shorter rest interval, but the strength gains is going to be a little bit slower rate compared to the prescribed guidelines. When we look at other resistance training goals, particularly muscle hypertrophy, this is going to have short to moderate rest periods during this time, and the typical strategy for muscle hypertrophy for this rest period is going to range from 30 seconds to 1.5 minutes. When we look at muscular endurance, this is going to contain very short rest periods of around 30 seconds or less. So in summary, we went over on selecting exercises based on the type, the sport specificity, the technique experience, equipment availability, and time availability. Also, we were able to determine the training frequency based on the training status, the sport season, the load, the exercise type, and other concurrent exercises. Also, how to arrange exercises in a training session, be able to determine an individual's 1RM, be able to predict the 1RM from a multiple RM test, and RM loads. Also, we went over on how to kind of assign load and repetitions based on the training goal. Also know when and by how much an exercise load should be increased. A lot of the things that we kind of went over through this chapter is, assigning the training volumes according to the athlete's training status and their training goal. And lastly, we determined the rest period lengths based on the training goal for the athlete.